In this video, we discuss a promising cancer treatment, neoantigen vaccines. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. The genetic instability of cancer often produces a large number of mutations. These mutations then produce a large number of strands of novel proteins called neoantigens on the surface of cancer cell membranes. If immune cells can be trained to identify and attack neoantigens specific only to cancer cells, then they will have a good chance at destroying cancer. Only in recent history have the techniques been available to sequence and target these neoantigens. Even after only a few years, neoantigen vaccines are beginning to live up to their promise as being the most effective cancer killer available. In 2015, the first clinical trial testing the neoantigen concept used dendritic cells, a messenger immune cell rather than an attacking immune cell, in 3 refractory melanoma patients. The neoantigen dendritic vaccine produced stable disease in 1 patient, a partial response in another, and a complete response in the 3rd. The next trial, published in 2017, was a neoantigen peptide vaccine administered to 8 people with advanced refractory melanoma. Melanoma is often used in these trials as it produces a large number of genetic mutations called a high tumor mutation burden, TMB. Cancers with high TMBs are often likely to respond to immune checkpoint inhibitors like Keytruda. So, if Keytruda is a treatment option for your cancer type, there is a good chance there may be a neoantigen vaccine trial for which you're eligible. The 2017 trial produced complete responses in 4 of 6 patients with stage 3 disease. 2 patients with stage 4 disease at first did not respond. Then they were retreated with Keytruda and achieved complete responses. After 4 years, all 8 patients were still alive, 6 with no sign of active disease. These results are quite simply extraordinary. However, they are on par for what subsequent neoantigen vaccine trials have produced. Neoantigen vaccines have also been tested in other cancers. 1 trial in 8 recurrent glioblastoma patients produced an overall survival of 16.8 months, far beyond the normal average of roughly 6 months. Another neoantigen peptide vaccine in 7 refractory pancreatic cancer patients produced an overall survival of 24.1 months, far greater than what would be expected as well. One of the more advanced companies pursuing neoantigen vaccines is Genosia. Their proprietary screening platform has identified neoantigens that are immune suppressive. So, the inclusion of this inhibitory antigens, which they call inhibigens, in a neoantigen vaccine could blunt the immune response. In 1 study that paired Genosia's GN009 product with an immune checkpoint inhibitor, ICI, 8 of 9 advanced melanoma patients who were responsive to ICIs remained progression-free over the course of 10 months. Efforts are also being made to have off-the-shelf peptide vaccines available for antigens that are commonly expressed in many cancer types. One of these, TAS-0313, was tested in a trial with 8 patients with recurrent glioblastoma and 2 with gliosarcoma. 1 patient achieved a partial response with 69% tumor reduction, while 4 more achieved stable disease. Another, 6-MHP, composed of 6 peptides commonly found in melanoma, has been tested clinically for over a decade. A retrospective analysis found that it nearly doubled 1-year survival compared to a control group. Another off-the-shelf peptide vaccine produced a 27% response rate in advanced refractory colon cancer. Patients also demonstrated improved immune functioning. No significant adverse events were observed. A treatment for prostate cancer based on this idea has already been FDA approved. Sipalucel T involves isolating a patient's dendritic cells, then incubating them with prostatic acid phosphatase, an antigen present in 95% of prostate cancer cells. When the dendritic cells are reintroduced, they trigger an immune response for this antigen. A phase 3 trial in advanced prostate cancer patients found the 36-month survival probability for the sipalucel group was 31.7% versus 23.0% in the placebo group. For more information about neoantigen vaccines, please see the book Cancer Self-Defense 10 Quick Tips to Help You Survive.